Okay, so let us start with the antifungals and antiparasitic in this video. The video just before this we have already covered antibacterials. Okay, so now we'll go with antifungals and antiparasitic. Look, this is the whole topic, that is antimicrobial is the main topic. It is the father of all this topic, and within these topics generally comes antifungals, antibacterials, antiparasitic, all of these come under the topic of antimicrobial. So we have just divided these topics, and in this book also the topics has been divided to make it more easier for us. Okay, so let us start with antifungals and antiparasitic. The first question they are asking is, which of the following agent is not used in the bacterial vaginosis? So generally if we talk about the bacterial vaginosis, this is due to a generally imbalance between the different bacteria in the generally vagina. So if we talk about the bacterial vaginosis, the question is asking not used, and the first option is generally metronidazole. So all of us know that metronidazole is the drug of choice. If you don't know, then know it now, because this is a very important question, that metronidazole is generally the drug of choice for bacterial vaginosis. This is vaginosis, huh? It is not vaginitis. This bacterial vaginosis is caused generally by Gardnerella vaginalis. ठीक है, Gardnerella vaginalis will be generally bacterial vaginosis case, and in the generally trichomoniasis case, there will be generally trichomonas generally will be responsible for this, and that will generally be vaginitis, not vaginosis. Okay, so let's move with the next option, that is tinidazole. Tinidazole is also used. Clindamycin can be used. Erythromycin cannot be used because this is not effective in bacterial vaginosis. Okay, so if we talk about macrolide, this is generally erythromycin is a macrolide which is used for gram positive bacteria, gut anaerobes, and penicillin allergic patients can also be supplemented by erythromycin. This is not effective in bacterial vaginosis. An HIV patient presented with neck rigidity and seizure. Okay, neck rigidity and seizures are there. CSF examination. Whenever we go for neck rigidity and seizures are there, the diagnosis that comes in our mind is generally meningitis. Okay, so CSF examination confirms diagnosis of cryptococcal meningitis. Okay, so this is cryptococcal meningitis or fungal meningitis. Which of the following antifungal is the preferred agent in this patient? So in this patient, generally liposomal amphotericin B will be generally the drug of choice, because this liposomal amphotericin B is nothing but lipid preparation of amphotericin B. This is less nephrotoxic. Generally amphotericin B is nephrotoxic. It is considered as a nephrotoxic drug, but if we prepare a liposomal, that is lipid preparation of this amphotericin B, this is less nephrotoxic. If we talk about the 5-flucytosine plus fluconazole, and this is generally added with LAMB. Okay, this is generally added with LAMB. Voriconazole, if we talk generally, this is LAMB is nothing but liposomal amphotericin B. Okay, it can be added. It is not the drug of choice for this case. Voriconazole, this generally it is drug of choice for aspergillosis. Fluconazole high dose. The fluconazole in high dose can be used for generally used after 2-week IV dose of lipotericin and liposomal amphotericin B to reduce the fungal load. This is just to generally reduce the fungal load, but the main stay of treatment will be liposomal amphotericin B. A patient who has just recovered from COVID-19 infection visits your OPD with black discoloration material in nose and posterior part of buccal cavity. Okay, so you are getting the diagnosis in your mind, that is COVID-19 का infection है, and the patient visits with you with generally a black discoloration material in the nose. So this is nothing but generally mucormycosis की case है. Generally this is diagnosis of mucormycosis. The next question they are asking you, he also gives history of using high dose steroid therapy during this treatment of COVID-19. This generally occurs due to this high dose steroid therapy also. Which of the following is most suitable drug for this treatment? So generally for this treatment, the generally lipotericin I am telling you, amphotericin B will be the drug of choice. Amphotericin B will be the drug of choice. So this amphotericin B generally it is the drug of choice for mucormycosis, cryptococcal meningitis, just we saw, है ना, amphotericin B for some time and then shift to fluconazole. We just here only we talked about this, that fluconazole is used after 2-week IV dose of liposomal amphotericin B to reduce the fungal load. So next will be generally the next question. If we see, there will be praziquantel is used for the treatment of, praziquantel will be used for the treatment of. So this if we talk about this helminths, generally for the platyhelminths, drug of choice for drug type 1 will be generally albendazole. Liver fluke will use triclabendazole, and all other helminths in the platyhelminths category, that will be praziquintal. ठीक है, praziquintal. Platyhelminths means nothing but the flatworms only. Nemathelminthes, if we talk about nemathelminthes, generally these are nothing but the roundworms. The drug of choice will be albendazole for all nematodes except a filarial worm. For the filarial worm, like generally Wuchereria bancrofti, for that generally it causes filariasis. For that we can use generally a drug known as DEC, diethyl carbamazine. Diethyl carbamazine, strongyloids and oncocerca will be treated with ivermectin. So if you remember this much, all your antiparasitic drugs can be generally remembered by this much only. ठीक है, यहीं से बहुत ज़्यादा क्वेश्चन आपको बन जाएंगे. So generally praziquintal is used for the treatment of cystosomiasis. Drug of choice for management of visceral leishmaniasis. Okay, so let's see about the leishmaniasis. Leishmaniasis में generally visceral leishmaniasis, mucocutaneous leishmaniasis, and generally dermal leishmaniasis will be. There are three types of leishmaniasis. So for the visceral leishmaniasis, the drug of choice remains LAMB, that is liposomal amphotericin B. It is IV single dose is enough for the treatment of visceral leishmaniasis. For the mucocutaneous leishmaniasis, again liposomal, generally amphotericin B will be used, and dermal, for dermal leishmaniasis, drug of choice will be metafocin, that is metafocin in the oral form. ठीक है, oral form will be used for dermal. So they are asking us for visceral leishmaniasis, that is liposomal amphotericin B. Parenteral sodium stevogluconate was used earlier, but nowadays it was a drug of choice earlier, but nowadays liposomal amphotericin B is preferred. So we'll go with liposomal amphotericin B as the drug of choice for generally the visceral leishmaniasis case. Drug of choice for cystosomiasis. For cystosomiasis, here we just saw cystosomiasis के लिए praziquintal है ना, praziquintal is used for the cystosomiasis, that is cystosomiasis is also called as bilharzia. ठीक है, bilharzia इसको बोलते हैं. And generally albendazole, metronidazole, this albendazole can be used in the treatment of all that nematodes. ठीक है, so cystosomiasis के clinical features, if we see, there will be flu-like symptoms, that is high fever greater than 100.4 degree Fahrenheit, muscle aches will be there, skin rash will be there, cough, urinary symptoms like cystitis and hematuria can be present in the case of generally cystosomiasis. So let's see once and for all, that is एंटी हेलमिंथिक एजेंट. सो नीमेटोड में जनरली कौन कौन सा पता है, ये बहुत इंपॉर्टेंट है क्योंकि नाम ही हमको याद नहीं रहते. So let's see, nematode is nothing but generally the roundworm. So in the roundworm, generally roundworm will be called as Ascaris lumbriocodes. ठीक है. The next will be pinworm, जिसको हम Enterobius vermicularis बोलते हैं. Hookworm, generally we have talked about the pinworm, Enterobius vermicularis, the planoconvex egg in generally the छोटे छोटे जो एक के पिक्चर देते हैं, वो जनरली हम किस में पढ़ चुके हैं, वी हैव ऑलरेडी डन इट इन माइक्रोबायोलॉजी. ठीक है, अगर नहीं किया तो वहाँ पे जाके आप एक बार देख लो. हुकवर्म में जनरली निकाटर अमेरिकनस एंड ए ड्यूटेनाली विल बी देयर. हुइपवर्म विल बी जनरली ट्राइक्यूरिस ट्राइक्यूरा, ट्राइकिनिया वर्म विल बी ट्राइकिनिया स्पिरालिस, गिनी वर्म विल बी ड्रैकेनक्यूलस मेडियंसिस, फाइलेरियल वर्म विल बी उचेरेरिया बैंक्रॉफ्टी एंड ब्रूजिया मलाई, and Onchocercus valvulus, Onchocerca valvulus. Threadworms will be Strongyloids, Stercoralis. And for all this, the drug of choice will be either albendazole or mebendazole can be used. For the trematodes are like generally blood flukes. Generally flukes come under trematode. Blood flukes जैसे कि Schistosoma japonicum, Mansoni and Hematobium. Lung fluke, Paragonimus westermani. Liver fluke, Fasciola hepatica. For the liver fluke, generally the drug of choice will be triclabendazole and बिथियोनॉल. ठीक है, बिथियोनॉल. यहाँ पे जनरली हम कौन सा यूज कर सकते हैं, फाइलेरियल वर्म के लिए वी कैन यूज DEC, दैट इज डाइथाइल कार्बामाजिन. एंड द नेक्स्ट इज ऑन्कोसर्का वल्वुलस, वी कैन यूज आइवरमेक्टिन, जो ऊपर मैंने आपको ऑलरेडी करवा दिया था. स्ट्रंगोइलिड्स के लिए भी हम जनरली वही यूज करेंगे, ऑन्कोसर्का एंड थ्रेडवर्म्स, दैट इज स्ट्रंगोइलिड्स, स्टोरकोरालिस के लिए आइवरमेक्टिन विल बी ड्रग ऑफ चॉइस. इन केस ऑफ ट्रिमेटोड, प्राजिक्विंटल एक्सेप्ट फॉर फास्क्यूला हेपाटिका, दैट इज फास्क्यूला लिवर फ्लूक के लिए जनरली विल बी यूजिंग ट्राइक्लाबेंडाजोल. सिस्टोड के लिए पॉर्क टेपवर्म, दैट इज टेनिया सोलियम, बीफ टेपवर्म टेनिया सजिनाटा, फिश टेपवर्म डाइफाइलोबोथ्रियम लेटम, एंड जनरल डॉग टेपवर्म दैट इज इकाइनोकोकस ग्रैन्युलोसस, एंड ड्वार्फ टेपवर्म विल बी हिम्नोलेप्सिस नाना. इसके लिए हम प्राजिक्विंटल एंड निक्लोसामाइड जनरली वी कैन बी यूज. मेट्रोनिडाजोल इज ड्रग ऑफ चॉइस, ये याद रखना. मेट्रोनिडाजोल इज जनरली ड्रग ऑफ चॉइस फॉर ट्राइकोमोनियासिस, जियार्डियासिस, बैक्टीरियल वेजिनोसिस, अमीबिक लीवर डिजीज, हाइडाटिड डिजीज एंड सिस्टिक सर्कोसिस. ठीक है, सिस्टिक सर्कोसिस. Drug of choice for fascicular hepatica, they are asking the same question again, that is nothing but triclabendazole. Drug of choice for neurocysticercosis, albendazole. Drug of choice for tinea solium will be praziquantel, and oral drug of choice for scabies will be generally ivermectin. Oral drug of choice for scabies will be ivermectin. देखो जनरली ये परमेथ्रिन हम यूज करते हैं, बट ओरल के लिए जनरली ओरल ड्रग ऑफ चॉइस व्हेन दे आर आस्किंग वी कैन यूज ivermectin. So generally only drug that can be used orally in scabies, all other are used generally topically. Drug of choice for rabies is permethrin, that is topical. इसलिए मैंने बोला था permethrin drug of choice है, but oral drug of choice if they are asking, that will be nothing but ivermectin. This benzyl benzoate generally only liquid with a faint aromatic smell applied over face and neck after a bath can be used for scabies. ठीक है, लिंडेन के लिए अगर हम बात करें, this has low efficacy than permethrin, it kills lice and mites, may be used for scabies, but generally we don't use linden for scabies. mites के लिए हम जनरली यूज करते हैं, lice के लिए जनरली यूज करते हैं. ड्रग ऑफ चॉइस फॉर स्केबीज इज नथिंग बट परमेथ्रिन, बट ओरल के लिए आइवरमेक्टिन. ड्रग ऑफ चॉइस फॉर फाइलेरियासिस, दैट इज ड्रग ऑफ चॉइस फॉर फाइलेरियासिस उचेरेरिया बैंक्रॉफ्टी, जनरली दैट इज नथिंग बट डाई इथाइल कार्बामा जीन. ठीक है, डाई इथाइल कार्बामा gene. Ivermectin is the next drug of choice for generally filariasis. Which drug is given in combination with diethyl carbamazine for massive reduction of filariasis? That is nothing but albendazole will be combined with DEC. Mechanism of action of amphotericin B. Amphotericin B generally alters permeability of the fungal cell wall. Cell wall synthesis inhibitor की बात करें तो echinocandins will be there, and protein synthesis inhibitor में generally tavoborol will be there. To reduce the amphotericin B toxicity, it is given in liposomal generally preparation, that is the lipid preparation. ठीक है, lipid preparation. Most serious side effects of amphotericin B. Most serious side effect of amphotericin B is renal damage, that is generally renal tubular necrosis is the most serious side effect of amphotericin B, and generally hypokalemia and hypomagnesemia will be seen. Which of the following drugs causes acute kidney injury with hypomagnesemia? Hypomagnesemia के साथ जनरली दिस इज नथिंग बट एम्फोटेरिसिन भी हमने जस्ट यहाँ पे acute renal tubular necrosis they will be causing. So this much for generally the antifungals and antiparasitic drugs. It was a very short topic, we just covered it in 10 or